This is the Art Beauty Podcast where we are always reaching for truth and beauty. Remember, the brands and the people on here are not paying to be here, so we get to ask them those deep questions we know you want answered because you deserve to be informed so you can make the best decisions for yourself. With that said, I'm Amber, and today my fabulous co-host is Dr. Oren Tepper. He is a board-certified plastic surgeon, and he is the director of aesthetic surgery at Montefiore Medical Center. And Dr. Tepper, first of all, welcome to the show.
Thank you, Amber. Nice to talk.
And you are coming from your brand new center that you just opened down in Tribeca, aren't you?
I'm from Tribeca, downtown Manhattan.
Amazing. Well, congrats on that. You know, we are talking today about something called the Boomerang facelift, or the Boomerang lift. You know, can we just get right into this? When I first heard about this, I was kind of confused. Is this sort of to like, is it a non-surgical procedure? Is it something to replace a traditional facelift? Like, what are we talking about here?
Yeah, I mean, it is a facelift in a way, but let me tell you how the Boomerang name came about and what it really is. So for years, I had studied the value and the effect of fat grafting to the face. And fat has been a wonderful addition to plastic surgery. Most people for decades thought, I'm having plastic surgery, let's take out as much fat as possible. The idea that you're putting fat back in was scary. It was exactly counter to what we talked about for years and what people really wanted. What we realized was that if you put fat in the right places, it actually serves as a really nice foundation for the face. It can add structural support and it can provide a lift. And so what the Boomerang lift is a way that you can non-surgically, so it's just with the injection of your own fat, create a bit of a lift. The name Boomerang was interesting. So we had done studies looking at what happens when you inject fat into the face. When we looked three-dimensionally at what was changing, it was in the shape of a boomerang. So Boomerang actually is exactly like you just did there with your hands. You're creating that Boomerang lift right here beneath the eye. And so that's where the idea of the Boomerang lift. And the nice thing was that the concept of Boomerang, right? It's almost a boomerang back to your youth. So, you know, the name really had a scientific basis to start.
I like that. Plus, you're right. We have boomerang. I love that, boomeranging right back into a more youthful you. You know, when it comes to fat loss, we hear so much about when we are aging, right? We hear about the collagen breakdown, the loss of structural support. Are we losing fat in the face? Because I know, you know, 20 years ago, I had a much rounder face, right? And when we're babies, we always see that baby round face. Are we actually losing fat there?
So two things. Yes, to some extent, as you age, you lose some fat. Technically or medically, we call that fat atrophy, where some of the fat starts to go away. But the other thing is fat descends. And so when it used to be up here, we're focusing here on the cheek and the lid, it used to be at the eyelid, lower eyelid, and the cheek junction. As that falls, or as you lose some of that, you really start to get this distinct line, this crevice. We call it the tear trough. That becomes more prominent. And that's a really difficult area for people as they age. I mean, you know, you see often as people age, sometimes if people are a little bit heavier or at least have full faces, they look a little younger. People who are,
You know, there is a well-known plastic surgeon here who's been on our show, Dr. Paul Jared Frank, and he always used to say, at a certain point, you have to choose between your ass and your face, right? Like if you want to be really slim, and you know, have that great ass, for lack of a better way of putting it, you're gonna lose fat in your face, right? But if you can carry a little bit more weight, your face might age better.
I don't disagree with Dr. Frank. I don't think you have to choose one or the other. Here's a solution that can give you both, right? It's
amazing. Amazing. I love to hear that. You know, so I feel like these days, so many people are talking about filler, right? And we've seen so many changes, different types of fillers for different parts of the face. Why is fat a better option, or is it a better option than, let's say, a traditional filler?
It's a different option, but it's really important that people understand what are you trying to achieve with what the treatment you're undergoing. And what I mean is filler works really well for fine wrinkles, for small areas that you need to sort of fill, right? It works well on the lips. It works well for fine lines. What I don't think filler works that well for is significant needs for volume. Okay, 2 reasons. One, it's temporary. So you put filler in, and all of a sudden you need a lot, but it's not there forever. So you stretch the skin, you lose it, and you've now actually done more harm in my mind than you have good. The other thing, and this has been a real problem in our world of cosmetic surgery, or really aesthetics in general, which is often people see individuals who they feel like they look overdone.
Yeah.
They attribute that to too much plastic surgery. Okay. What I want people to really think about is when you look at someone, whether you know them personally or whether you see it online, who seems overdone, is it really surgery you're seeing? Because often, more often than not, it's not too much surgery, it's too much filler. It's too much volume. And so my concern with filler, my issues around filler is not that it's not effective. It's great for certain things. I don't think when you're talking about lifting the face, adding structural support, doing something like I described, the boomerang lift, I don't think filler is your answer. And I think it could take you in the wrong direction. You do that repeatedly, and you start to really stretch the skin, and you get damage to those areas. It's not helpful.
And it's also a slippery slope. I would just like to take a minute for a PSA here. If you are doing any sort of filler or Botox, you need a filler friend. You need somebody who's going to be honest with you and say, time to put that syringe down, baby. Like, stop. Because you hope that your doctor will do that, but sometimes you just need a good buddy who's going to say, enough is enough.
I love that. And you need a good dermatologist to do that. Dr. Frank, I didn't hear him on your show, but I know him professionally. Lots of dermatologists, the ones I respect most are the ones who say, something, you've exceeded, your anatomy has exceeded what I think the filler is going to achieve.
Right.
And it's time to now start thinking about surgery. Now, the boomerang lift is a nice transition. If you are not ready for surgery, but you need, you feel like you need a significant amount of volume, fat is your answer in that area. It really is. And the beauty of fat, unlike filler. So what fat really represents is, you think of fat as a bad thing. What it is a milieu of actual stem cells. Okay. So you don't just add volume, you're improving skin quality. I have a few patients who have scars in the area that we put fat rather. The scars get better because you're introducing all those important growth factors that help the scarring.
Okay. I mean, we like to hear that. Before we get into the actual procedure, I wanted to ask you, you started to touch on, if you're not ready for a facelift, if you're sort of in that in between, who is this really good for, right? Is there like a good target age? And I know so many people's faces are different, but, in your professional opinion, where are you seeing people in your practice come in for this?
All right, great question. A couple of big areas. One, people who have lost weight, and they've lost weight, rapidly. We see this with Ozempic. Anybody who's, of course, and we see with people who, through their own lifestyle changes have lost weight and significant amounts of weight, or over a relatively short period of time. That's an area where fat in this area can really provide the volume that you lost. Okay. The second area is that sort of middle age group, right? It's not a skin problem. Things haven't descended in terms of the neck, the jawline. It's really just happening here in the cheek, right? A good way to test that is if you smile and you have good volume up here, but you lose it when you sort of don't smile anymore. That's a great candidate for filler. And then others is that third category, maybe a little bit older. Maybe they've had their facelift. They don't want to undergo another facelift. They may not need a second facelift. They may just need some volume, some support, and the boomerang lift in that population works wonderfully well.
So I was only raising my hand. I went to my dermatologist just yesterday for my Botox, and he was like, it could be time for a little bit of maybe like sculpture in the cheek area. But hey, listen, maybe you can convince me to change my mind here. In terms of the procedure, let's walk through that, because you mentioned before that this is it an in-office procedure, like an outpatient procedure?
Office procedure, outpatient. I tend to give people a little bit of sedation, more just to harvest the fat so they're comfortable. But they certainly don't need a breathing tube or things like that. it's important. Amber, you just mentioned the sculpture to the cheek. So that is one of the earlier sort of interventions for volume in the cheek. And I think sculpture is fine. But somebody who's having to go back and do a lot of sculpture and do it often,
Yeah.
you may want to think twice about what it is you're trying to achieve. The difference with fat grafting, and the way I do it and the way I described it and published on, is that it needs to be put on the bone. Okay, so one of the issues around just adding filler or certain substances is if it's just below the skin, you can get lumps, you can get bumps, you can get some discolorations.
Yeah.
The idea, the way that the fat grafting, the boomerang lift is intended to be performed and done, is you're just layering onto your natural cheekbone and you're just augmenting what's there. So no incisions. You harvest fat, takes about 10-15 minutes to harvest fat. We tend to like, or men who do this too, tend to like either the belly, the lower part of the belly, or the flanks and the hips. And it's an injection through needles. The whole thing is less than an hour.
I mean, how much fat are we taking? Is this like if you got that little pooch, maybe get your 2 for 1, or is it not that much fat?
It's the question that every patient asks. A really good one, because it's always, I have plenty, take it from, you don't need very. If you're talking about getting rid of the pooch, that's really doing liposuction.
Yeah.
You need a couple syringes of fat, and that's it.
So wait, so are we not, in order to harvest the fat, are you not using sort of a liposuction cannula and sucking it out?
No, it's exactly what we're using. You're spot on.
Okay.
But the way you do it is a bit different.
Okay.
So typically with the liposuction, when you're talking about larger volumes, you're using power assisted liposuction, where there's sort of a natural vibration. It's a little bit more traumatic and the recovery is a little bit harder. The boomerang lift, none of that. It's all handheld. It's simply just taking a syringe and pulling out some of that fat. So it's a much easier thing for patients to tolerate.
Right.
And the recovery is minimal.
I mean, okay, but like not enough. Like if you got that little arm pooch there, we're not talking that much fat. I'm trying to, get the most bang for our buck here.
People want it, absolutely, we can do that. So, and it's, but what I'm saying is, it's not, if you're simply just taking fat to transfer it, it's not enough to get rid of those areas.
Gotcha. And now when it comes to fat, so, I'm going to be honest here. It's been a while since I've spoken with a professional about fat transfer. Please correct me if I'm wrong, but I remember, when we were talking back in the days of like the BBLs, which I know is considerably more, if you're getting liposuction, putting it in places. One of the issues that I remember hearing about with fat transfer was that it was not as maybe predictable as some of the other sort of fillers in terms of, will the fat take, will it die out? What are your thoughts on that? And was I completely wrong?
No, you're completely right. So first, let's compare it to fat grafting elsewhere in the body.
Okay.
BBL, Brazilian butt lift, is what you're referring to. We do fat grafting for breast augmentation at times. The amount of fat you're talking about when you do a BBL is liters. Okay, so we're talking, let's say 2,000 milliliters or cc's of fat. Yeah, it's a container.
Big bottle. Yeah.
Of course, there's the liters of soda, exactly. 2 of those. When we talk about to the fat of, or rather fat to the face or the cheek or in the boomerang lift, you're talking at max 20 cc's.
Okay.
So it's 100 times less when we're talking about to the face, or 100 times more when you're talking about it elsewhere on the body, those large volumes. So it is certainly a lot less, but it's more predictable in the sense that you're layering it through tissues that will then engraft, or it'll provide a blood supply to keep it alive. So I found that fat to the face is very predictable, less so. I think it's highly likely to take in this area around the, I mean, I have dozens, hundreds of reconstructive cases that I do fat grafting to, that you see that it really does a tremendous job offering, nice support that lives. And then the other thing is, we plan for about half of it. So it's semi-permanent, right? Unlike filler, that filler is going away 100% of the time. Right. And you're going to come back for more. Not the case with fat.
So are we going to have sort of that instant gratification with the fat, that you would with a filler?
Yes.
Okay. And then, sorry.
They love it. I know you have instant gratification, Now, what happens off, I mean, I'll give you an example. I do a rhinoplasty often on patients who say, I really like the swelling that I had after my rhinoplasty. My cheeks seem full. And I said, great. You're a good candidate for a boomerang.
That's amazing. I always say too, if you've done lip filler, which I have not done, but if you do it, and I've had a number of friends who have done it, and you think it looks great in the recovery, like you didn't do enough.
No, that's the speech I give everyone. I say, here's what's going to happen. Tomorrow, you're going to say I did too much. And then the next day, you're going to say, I love it. And then you're going to come back in 6 months. You're going to say, next time we should do a little bit more.
We should do a little more. I do want to just take a quick second, because so much of any aesthetic surgery is in the hands of the provider. I want to give you a shout out because I did a deep dive on your social media, and you are an incredibly brilliant reconstructive surgeon, helping rebuild the heads of conjoined twins. I've seen you reconstruct lips. There was a woman who seemed like maybe she had a traumatic eye. I would say, for everybody listening right now, can you tell us what your Instagram handle is? Because you should go and check this out. It's really impressive. And I just wanted to kind of say thank you, because you are a very gifted surgeon.
I appreciate you saying that. So my handle is at Dr. Oren Tepper, and I do try to highlight both parts of what I do, which is reconstructive and aesthetic. Look, I appreciate you saying that, and I'm flattered by it, but it's an important part of how I approach patients, which means a lot of my skill set comes from what I did from a reconstructive perspective. And the other thing, and you said it in the beginning of this podcast, which is no matter who your physician is, they should be able to say to you, here's what I think you need, and here's what I think you don't need. And I know, having that reconstructive sort of part of what I do, it is ingrained in me to tell people, look, you don't necessarily need to do this. I think this would benefit you, and I think this may not. And I hope for anyone listening, if you're going to see somebody for injectable surgery to look better, that you're hearing what they don't need equally as much, or they're prioritizing as to what you do need. Because if they're only telling you what you do need, you may be in the hands of somebody who's just may not have the same aesthetic you do, or might be overdoing it.
No, and I have to give it out. A lot of the doctors we talk to also won't really kind of offer that up front. It's kind of like they wait for your patient to say, here's what's bothering me, right? You might not want to walk into your doctor and immediately, unless you know him for a long time, have him give you the list of everything. That's just a thought there. But certainly if however, if you're like me and I go in and I'm like, what can we do? What's the newest? What's the latest? What's the greatest? And we generally kind of start like that.
Right. You're in that world, but certainly no, it's important for the physician or maybe the patient to say, look, I ask my patients, how specific do you want to be? You came to me for this. Do you want to hear my whole assessment on how your face, could change or not? If not, we'll just talk about what you came in with. But for the patient going in, if you don't want to hear the other stuff, maybe you need to preempt and say, look, I'm here to just talk about my eyes, and that's it. So don't throw a facelift on me, or let's not, sell me on something else.
And thank you for saying that. It is good to remember, look, like every other profession, there are amazing, wonderful doctors, derms, surgeons, and there are some who are going to just try to, maybe, make a buck. So use your best judgment. Going back to this boomerang lift. So this is an in-office. We harvest the fat. Then you're going to inject it into that boomerang area along the bone using a needle. This is done under sedation. I'm assuming maybe a little numbing, like you would if you were doing any injectable.
Little numbing. Look, some people do it fully awake, and I have that conversation with patients is, how much we can be talking the whole time, or you could be drifting off to sleep. You tell me what's most comfortable. None of it involves incisions, like you said. It is injecting fat here to create that boomerang lift. And just to be technical for a second, what we're trying to achieve are two things. We want the lift in the cheek that people have lost, and we want to blend the junction between your lower eyelid and your cheek. And Amber, you complimented me. I'm going to use you as an example. You have a very nice transition between your lower eyelid and your cheek. And what people are trying to avoid is that depression where you very distinctly see those two. That can look at times like someone's aging.
Well, thank you so much. Just hit 44. But I did a go in yesterday. I was like, under eye filler. My doctor was like, no. Absolutely not. You don't need this. So thank you, Dr. Jabber. Shout out to you. One of the things that I also just want to quickly touch on, but I don't want to go too much. Under eye filler can be very dangerous, correct? I mean, like that's one of the things I've had
Yeah.
I can never say this. Surgeons, ophthalmologic surgeons, eye surgeons essentially on who are like, please tread very carefully in this area.
Yeah, you need to be careful. It can be dangerous and it can be tricky. So
Yeah.
blindness is rare. It happens. People need to know that. I'm not scaring people off from having filler. It's been reported, and people need to be super careful.
Yeah.
The other, which is more common, is it can really be, the skin under your eye is exceptionally thin, really, really crepey, right? And it's like tissue paper. And because people who have that super thin skin, where you really just feel the bone as you're touching your lower eyelid, need to be careful about putting filler or too much filler there, because you can see it and you can feel it.
And it also has like a little bit of a bluish tint to it, right? So we can have that. So you're talking, it can actually make that discoloration worse. So with the fat and the needle, is it a bigger needle than injections? Because I'm assuming that a lot of people on here might have either, who would be interested in this procedure, maybe have done a filler and they're like, hey, this isn't working for me, or I have to keep going back, it's getting expensive, I'd like to try something that's a little more semi-permanent. Or maybe they haven't done it before. In terms of describing that experience, the pain difference, the needle, can you enlighten us on that?
Yeah, of course. It's the same needle size. The one difference is it's a blunted cannula, which is essentially like a hollow tube with a little bit of curve at the end, which really keeps it in the tissues versus getting into blood vessels. That's the real difference. Other than that, it's essentially the same. I should mention there's some other things. Look, the amount of volume that you can give with fat. Imagine we talked about a liter. Imagine 10 milliliters of filler. That can get really expensive for something that is temporary.
Yeah.
You pay per syringe, right?
Yeah.
That, we're getting it from your own body. We're not buying it from a distributor, right? So, there's no real limitation, not for those volumes, on how much we can get. And then the other thing I want to mention is you can tailor it. So the boomerang lift, the way I described it and the way I talk about it around the country and the world, is delivering it here at the lower eyelid and the cheek junction. But there are nuances to that. You can carry it, for example, into here. This is the temples. One of the things, I can see you, I'm sure you know about this, which is you start to get a little bit hollowed over here.
Yeah, I'm a good example for that. Yeah.
But people notice, and when I point this out, people don't always see this. You go from a rounded appearance here to a bit of a sunken in appearance. You can add some volume here. Up here in the upper eyelids, sometimes people have over-resected skin, or they start to have a little bit of hollowing up here. The treatment for that is not more skin removal. It's adding a little bit of volume so you don't see the underlying bone, or you soften that transition.
I mean, I'm loving everything that you're saying here. You mentioned before the cost of filler. Now we know that where you are in the world, where you are in the country, prices vary. But here in New York City, can you give us a ballpark for somebody for what a range of this might be?
Yeah, look, it is a big range where you are in the country, world, etc. But let's say the fillers themselves, what they cost to people, are pretty standard. So most people charge anywhere from, let's say, $500 to $1,500 per syringe. And that depends on where you're treating or what you're doing it. That's ballpark. If you're looking at sort of a straightforward boomerang lift or fat grafting to the face, that's anywhere from, let's say, $5,000 to $15,000 for that.
Okay.
But now $15,000 may seem like a lot for talking about injections, but keep in mind, you're talking about one treatment, maybe some additions down the road years later. When you talk about filler, you're talking 6 months, 12 months. You're just continuing to inject.
So that brings me to my sort of other big two questions, which I mixed on. What is the downtime or recovery time with this? And then how long is it going to last? And I know, of course, varies patient to patient, but sort of ballpark ranges.
So the downtime is essentially a few days. There's not much in terms of limitations of what you can do, but people tend to get black and blue and bruised. So it's
Yeah.
more of, can you be out socially, or are you comfortable going to work the next day? Medically speaking, there aren't much in the way of limitations. I tell patients, I need you to not work out heavily this week, just to take it easy. And that's really to minimize bruising, not because I'm concerned that something is going to happen, that's concerning. So that's on the recovery side. And then the second question, sorry, you asked was regards to
how long does it last? You mentioned before that this is something that is this theoretically, could it be a one and done?
It could be. So it's a really important question. So I said about half of what we put in stays. We know within 6 months what has survived, what is engrafted, let's say the technical term, is there. Okay, we know it's not gonna, if it's taken, what you see at 6 months is what you're going to achieve out of fat grafting. That is forever. Now, what I cannot stop is aging from continuing.
Right.
So you may still continue, like I said earlier, fat atrophy. You may lose some fat in your face as you continue, and if to age, and if you do, the fat we put in will happen, to that fat equally as much as it may happen to elsewhere in the face. So I can't stop that process from happening. The flip side is also a really important question. People say, is all of a sudden, if I gain weight, is it gonna all of a sudden start to hypertrophy or grow in that area? And the answer to that is no. And that's really important for people to understand. If you gain weight after, you will gain weight, or you will expand some of that fat in the face equally everywhere. It's not like all of a sudden just the fat we put in is going to be where you see a change.
So there will be more. That's funny because I talk about liposuction now and how it's changed, but we know, like, in the early, like 80s, 90s, people might get it in the stomach would end up with sort of, and men specifically might end up with like a fuller breast, right? Because the fat, if you don't change your lifestyle, like your fat cells are expanding. You have a finite amount of fat cells, theoretically. Am I right? So we don't have to worry about weight gain with this.
You don't. And the whole notion of gaining fat in one part of the body or not is really a reflection. If you've completely depleted somebody of fat in a certain area, sure. Yeah. But the whole point of this is you're doing this exactly, your small changes. And that, by the way, should be the same for liposuction. People shouldn't be overly aggressively liposuctioning a certain area where there's no fat cells. Fat's important.
Yeah.
So if it's done correctly, no, it shouldn't. It should not change preferentially in one area.
One last thing I want to get your thoughts on. I actually met somebody recently, and they couldn't do filler. They're like allergic to something in it. Or they had some sort of issue. I can't remember what it was, but I have to imagine that, because it's your own body, when we were talking about the benefits of maybe fat over filler, that probably if there's people who have sensitivities or to a traditional filler, that this would be a good option.
Some people have issues with the preservative that is used in fillers, and that can be an issue. Of course, this is your own body's, nutrients.
And then one last thing before we kind of start to wrap this up, we talked about who this is good for. Is there anybody as a professional who, like, this is not good for?
Well, I certainly don't like to do this in people who have existing filler in place. So I want things to be relatively stable when we're talking about adding new volume to the face, because I want to be looking at a sort of clear canvas, right? I don't want all of a sudden things to start changing or evolving over time. So that's one important thing. The other is people who have, you want someone who has relatively good skin quality, because the skin needs to accommodate the fat as well. So that's an important thing. But most people are good candidates, if this is what they're seeking, volume in that area.
When you mentioned before, people when you're talking about people who have had existing filler and you want a clean slate, how long is that? How do we know?
Well,
somebody's sitting there saying,
I just want I want to wait. I mean, I'm not going to go dissolving things. Look, I will say, let's give this 6 months. Let's let your face kind of get back to baseline. And then we can talk about how much, because otherwise I'm going to under deliver because I'm going to give a certain amount of volume. Now, all of a sudden the filler goes down and I should have provided more. And I want to hit it right, the first time. The other thing I should mention, Amber, think about buccal fat. I don't know if you've spoken about that of recent, but there's some trends on that.
All the people removing it, which I'm just like, please don't do that. I had such a round face as a baby. And one day, all of you young, beautiful babies out there, you're going to want that fat there.
I love what you're saying. I'm going to make all my patients call you and check in and make sure that they're hearing the right things before they do this. But you don't want to over resect there. Not everyone's a candidate, right? You want to have a little bit of contour here, but take out the right amount of fat. And the reason I bring this up is because if you think about what you're trying to create, you're creating a transition from the upper cheek to the lower cheek.
Yeah.
And most people think, well, the answer to that is just taking out volume in the lower cheek. But imagine with something like the boomerang lift that you can add volume right above it. So you can create that transition that people are looking for, that we often see with cases of buccal fat, without that situation of exactly what you're saying, which is all of a sudden you're going to have this hollowed out appearance to the cheek.
Don't do it. I want to just kind of finish on this. And thank you so much for your time, Dr. Tepper. If he sounds like he knows everything about this, we didn't shout this out at the beginning. You were actually the pioneer of this procedure, along with Dr. Glenn Jelks, correct?
Correct.
Okay. So
Dr. Jelks, he's a world authority in eyelid rejuvenation and reconstruction. Him and I have been really sort of studying this and talking about this for years.
So if people want to know more, if they want to come and see you, how do they find you?
Instagram's a great place to start. Like you said, at Dr. Oren Tepper. Websites for those who still look at it, orenteppermd.com. But we have a new office, like you said, downtown, 497 Greenwich Street. We do virtual consults if people just want to learn about it first before they come in.
That is absolutely amazing. And, do you have any suggestions? Are you the only 2 people in the world who are doing this, or is this something that's become more commonplace? And if so, do you have any recommendations for people to find doctors in their area who can provide this?
Yeah, most people do fat grafting to the face. I'm far from the only person who's doing this, in New York or around the country. But what not a lot of people are doing it is in a structured fashion and using the algorithm we do. The boomerang lift, yes, it's a catchy term. I understand that. The derivation really lives, the whole description, in our plastic surgery literature. So if you're going to see a plastic surgeon, I would ask them, have you read the article on boomerang lift? And do you do something like that? And, certainly the people in my medical community, they know the journals that we, all look through. And this was one of those articles that was sort of a landmark paper.
Amazing. I, again, want to thank you so much for your time, Dr. Tepper. Clear that, you're opening my eyes to maybe some alternatives to those fillers that we hear so much about. If you have questions you want me to pass along to Dr. Tepper or his team, I'm happy to do so. You can email me at hello@artbeautypodcast.com. Find us on Facebook, Instagram, and YouTube at Art Beauty Podcast. And as always, we will see you next Tuesday, hopefully feeling a little bit more lifted.
Great talking with you. Thank you so much.